Today's topic is protein synthesis inhibitors, and this group includes tetracyclines, and most commonly used tetracycle is tetracycline itself, but also doxycycline. The doxycycline is more effective, long-acting, and also aminoglycosides, including gentamicin and streptomycin. So these are the old ones, and amikacin and neomycin and tobramycin, the newer ones. Then our third group is macrolides, includes the erythromycin and old one erythromycin and clarithromycin and azithromycin, the new one. So clarithromycin is most expensive and actually most effective of all these. Then there are also lymphozymides, including clindamycin and linezolid. So we will so the mechanism of action of these drugs is inhibition of protein synthesis. So different groups of these drugs are connected with the different ribosome subunits, and the tetracyclines are named because of the chemical structure. So they have 4 cycles fused together, and so this is the formula for the tetracycline. They also have many hydroxy groups that makes the molecular charged, and also amide group at the end. This chemical structure is actually pretty unique. So usually we don't have 4 rings fused. And the mechanism of action of tetracyclines include the inhibition of binding of transport RNA to matrix RNA. And that prevents the synthesis of the proteins. So, and as you can see, the tetracycline will bind with the S30 subunit, so the small subunit of the ribosome. Then aminoglycosides bind also to the S30 subunit, and they lead to the misreading of the codon from the matrix RNA, and that also will lead to the production of the protein that is not correct. So and that is that this protein will stop production if the codon is stop codon. Then erythromycin and clindamycin are bound to the S50 subunit. So this and they inhibit the translocation step when the ribosome moves from one codon to another codon, and that stops the synthesis of the protein as well. Chloramphenicol inhibits peptidyl that transfers the amino acids according to the by the transport RNA, and that leads to that stops the producing of the protein as well. And linezolid binds to the S23 ribosomal RNA, preventing formation of the initiation complex. So the ribosome will not be two subunits of the ribosome will not connect together, so that actually also prevents the protein synthesis. So these are the different mechanisms of actions. Like different groups differ. The groups here differ by binding to different subunits of the RNA. Tetracyclines and aminoglycosides bind to the S30, others bind to the S50 subunit, and also different steps of the uh, translation are inhibited by these uh, antibiotics. And we start with the tetracycline spectrum of action. So, and tetracyclines have a broad spectrum of action than the penicillins, for example, and they however they cover pretty the same of the gram positive microflora, including the Streptococcus Pneumoniae and Staphylococcus aureus, and in case of the Staphylococcus aureus, they cover the methicillin resistant strains because they are resistant to beta lactamases, so they don't have a beta lactamate. And then Streptococcus pneumoniae is common cause of the pneumonia in adults and children, and that is also covered by the tetracyclines. Then the anthrax is also covered, but it's very rare now. And mostly the tetracyclines are effective against the gram-negative microflora and also different other types. So because gram-positive microflora is not covered much by the tetracyclines, like only Streptococcus pneumoniae is covered. The gram-negative microflora includes the Vibrio cholera. The leads to the cholera is a GI disease. Usually, the contamination is done by the ingestion of the contaminated food and dirty water, and usually seen in children because they don't wash hands before the meal. And the cholera is secreting the toxin that produces diarrhea, and the recommended treatment is doxycycline because the doxycycline has a high bioavailability, and also fluid replacements may be required in case of the severe diarrhea. Then Yersinia pestis is leads to the plague, and then it's very rare in modern world. And Brucella species will lead to the brucellosis, that is a central nervous system disease, and can be treated with the tetracycline and gentamicin combination. Then anaerobic organisms include Clostridium perfringens, and that is the GI diseases in the intestine, and also Clostridium tetani leads to the tetanus of the skeletal muscles. Then spearheads include very important Lyme disease. Lyme disease is not common in Russia, but is common in many South countries, and the bacteria is Borrelia burgdorferi, is transmitted by the bite of the ticks. So, and usually that infection is transmitted outside when camping in the forest, and the infection has a specific bull-eye pattern. Over the hemisphere. So and this pattern has a red outer ring, and is very characteristic. The symptoms are not characteristic and usually include headache, fever, um, but the diagnosis is usually made by the rash on the skin. Uh, Later, the disease is progressing to the meningoencephalitis and arthritis, and eventually a death is not if not treated. And treatment is also by the doxycycline. Um, then Leptospira leads to the leptospirosis, and Treponema pallidum will lead to the syphilis. So this spirochetes are covered. Treponema pallidum can usually is treated with the penicillins, but tetracycline can be used for those patients who are allergic to penicillins. Then Mycoplasma pneumonia is a atypical pneumonia or walking pneumonia. Is commonly seen in young adults that live close together, like for example in dormitory or in military camps, and treatment is also with the doxycycline. Mycoplasma pneumonia is different from the Streptococcus pneumonia because mycoplasmas cannot be identified easily, so special staining is required because of the cell wall structure. And then chlamydia species leads to the chlamydial infections, is the a sexually transmitted disease, and it leads to the urethritis, pelvic inflammatory disease, and lymphogranuloma venereum. And some species may lead to the pneumonia, and also hepatitis, myocarditis, and coma and death. Doxycycline can be used for the treatment, and also azithromycin can be replaced the tetracycline. And the last one, but not the least, is Rocky Mountain spotted fever. So it's rickettsiosis, the disease caused by Rickettsia rickettsii. It's also same as Lyme disease. Symptoms are fever, so not specific, and also ashes in bones and joints, and requires prompt treatment. So the name is given by the place where the disease was first identified, the Rocky Mountain spotted fever. So it is the mountain that is used for the gold mining. So, and this fever actually first was discovered there. So, so the Rocky Mountain is a geographic location that initially was popular because of the gold mining. Okay, then so this is the antibiotic spectrum. So mostly here the different groups of the drugs, different groups of the bacteria and many diseases, so are treated with a doxycycline. And doxycycline is available as in oral forms, and they also enter the central nervous system. They also can be injected intravenously or intramuscularly, and excreted by doxycycline is excreted by the bile, and all the tetracycline is excreted with the urine. Then the oral administration of a tetracycline should not be done with a meal. So as we can see, tetracyclines should be given on empty stomach, and only then they will absorb completely. So with the meal, or with the aluminum hydroxide antacid, or with the milk, the absorption is greatly reduced, because a tetracycline will bind to the aluminum ion or to the calcium that is in the milk, and that will prevent absorption, because it will lead to the uh, formation of the insoluble uh, substances. Then adverse effects include GI disturbances, deposition of drugs in bones and teeth, may be seen in children after the age of 18, and that is why the ointment of tetracycline should not be used in children up to age of 18, and tablets can be used from age of 14. Liver failure can be seen in patients with liver diseases. Phototoxicity is pretty common. That is why the patient should use covering clothes, or avoid sun exposure, or using the sunscreen. Vertigo can be seen in high doses and contraindicated in pregnancy because of the uh, uh, because of the influence to the bones. So tetracyclines will deposit it in the bones and lead to the diseases of the bones, like the and also of the teeth. So that is why absolutely contraindicated in pregnancy. Then the uh, for the gentamicin, and there are the spectrum of antibiotics is mostly gram negative, but also for the gram positive is Enterococcus species and Streptococcus Antalactiae, uh, and gram negative include uh, Brucella species, and also Francisella tularensis, and Klebsiella, Pseudomonas aeruginosa, and Yersinia pestis. So most commonly used diseases are tularemia. So tularemia is a disease of the hunters, because it's obtained bunny during the bunny hunting season. So do you know what is a bunny? Hello? Anyone still here?
No, I don't know.
Um, like it's an animal.
What?
It's an animal.
Yes,
Uh,
yes.
do you know?
Yes, I know.
So how it looks like? Ra-
Like
Rabbit.
rabbits, yes.
Rabbit. You know?
Right?
Yes, right.
Mhm.
Uh, so uh, so rabbits are actually during the hunting season for the rabbits. The hunters will skin the rabbits, and the blood will sprinkle to the air, and uh, they can be infected through the lungs by uh, uh, breathing the air that is around. So this is a lymphoid disease treated with the gentamicin. So then also Pseudomonas aeruginosa is so you're already familiar with the Pseudomonas aeruginosa. So it can be treated with uh, streptomycin. And then also there is a synergy between the beta-lactam antibiotics and aminoglycosides. So, for example, ampicillin can be combined with a gentamicin for the treatment of some gram-positive bacteria, including Enterococcus and Streptococcus agalactia. And also for the brucellosis, it's combined with the doxycycline. So like this brucellosis, yes, here, this is combination. We already talked about that when we discussed the tetracycline. So brucella can be treated, brucellosis can be treated with a combination. It is more effective, much better because of the synergy between these groups. Because uh, some bacteria is not cell wall is not permeable for the tetracyclines, sorry, for the aminoglycosides, and these and beta lactams uh, destroy uh, the cell wall and make it more permeable for the aminoglycosides. So because they inhibit the cell wall uh, structure. So aminoglycosides are only used parenterally, so there is no oral uh, drugs, and can be injected intravenously, intramuscularly, and intrathecally in the brain because they don't penetrate to the central nervous system. If there is the disease in the central nervous system, like for example meningitis, should be treated with the intrathecal administration. And also topical administration is available for the skin diseases, and the drugs are eliminated by the urine. Okay, and they also eliminated unchanged, that is what can be used for the diseases of the blood. Adverse effects include ototoxicity is very characteristic for the aminoglycosides. Nephrotoxicity is also can be seen. Paralysis can be seen uh, in some patients because of the uh, toxic action, and then skin rash usually seen with the topical application of the drugs. Then the next group is azithromycin and uh, erythromycin and erythromycin. So these are the most broad spectrum antibiotics. So they cover the gram-positive Streptococcus pneumonia and also Streptococcus pyogenes that will lead to the fever diseases. Then Corynebacterium diphtheria, that is a GI disease. Penicillin is also can be used for the treatment. Then gram-negative also covers Moraxella catarrhensis and Neisseria gonorrhea. Neisseria gonorrhea is a sexually transmitted disease. Then also gram-negative rods include Bordetella pertussis, Campylobacter jejuni, Haemophilus influenza, and Legionella pneumophila. Legionella pneumophila is a very rare disease. It's asymptomatic, and it's called Legionella or Legionellosis because the first disease was discovered and spread. The epidemic of the Legionellosis was was encountered during the meeting of the legion of the soldiers in United States. So, and they all gathered in one place from all over the countries, or all over the states. Then they transferred this disease, then and they returned back to their homes, and then transferred these diseases to their families and neighbors. So, and then there was a large outbreak of this legionellosis. So, azithromycin is effective. Also, fluoroquinolones can be used. So, but fluoroquinolones are actually another group. Then Treponema pallidum is a syphilis. So then Mycoplasma pneumonia is a atypical pneumonia, also can be treated with this one, Mycoplasma pneumonia with a tetracycline. So and so requires special identification technique because cannot be identified like the gram positive. So it's not gram positive. It's a mycoplasma with the nucleic acid in the cell that is impermeable for the dyes. Uh, and azithromycin or doxycycline can be used. Azithromycin is actually doxycycline actually we already discussed here. So doxycycline is a tetracycline. So and azithromycin is actually more effective. Then ureaplasma urealyticum is a disease of the bladder. Leads to the uh, this dissolution of the tissues of the bladder. The chlamydia infections can be treated also with the doxycycline or azithromycin. Doxycycline is a tetracycline. Chlamydia may be different, like pneumonia, trachomatis is bone disease, psittaci is with a fever, and the last one is Mycobacterium avium complex seen in HIV patients and usually treated with the combination of azithromycin, rifampin, and ethambutol, and this is a MAC or Mycobacterium avium complex, usually seen only in patients with HIV. So, and usually the prophylaxis is required for the patients with AIDS. It's not seen in the normal patients without HIV. And these drugs will not penetrate to the central nervous system, only intravenously injected, or sometimes maybe used like yes, most of them also that are available orally. And azithromycin uh, eliminated by the bile, clarithromycin by the urine. So clarithromycin is actually the most expensive of these drugs and most commonly used of them. So, and the adverse effects include also ototoxicity, like a previous group, and also jaundice and GI disturbances if used orally. And also, if intravenous also can be GI disturbances. Jaundice can be seen in patients that are predisposed to jaundice. So that is all for today, and thank you for your attention. If you have any questions or comments, then feel free to ask them in the uh, uh, below.